Hey everybody, it's Julianna here at Evolve to Perform, and I wanted to talk about something that we've been seeing come up a lot lately in our patients that we see here, and something that I've been seeing more frequently, and that's people who complain of pain here on either on the outside of the foot, or anyone who's been told that they maybe have more of a flat foot or a decreased arch on the inside of your foot. Sometimes it could present a little bit similar to like an Achilles tendonitis or tendinosis. And I'm going to be talking about some of the ways that we can go about that and kind of maybe some of the reasons why that might be happening. So if you're getting pain here, right here on the outside of this foot, and you are someone who either has been told that you have a little bit of a lower medial arch or a little bit more of a flat foot, or maybe something that you might not even be aware of, but that would be when your feet kind of collapse inward towards the ground. So what that does is it puts a little bit of extra pressure and excess use of some of these muscles that kind of sit on the outside of the lower leg like this. So that can sometimes cause pain and discomfort from that overuse over time, and maybe even some of those tendons in the back of the foot and the back of the ankle. It could also be someone who has a history of chronic ankle sprains, and maybe you have a little bit of instability in that part of the foot. So that could all be kind of contributing to the same pain in the same areas that you're kind of feeling. So the goal of this 3-part video series that I'm going to be taking you guys through is kind of building up a progression of kind of where to start when you're kind of working with this kind of pain and discomfort, where we can take it in the middle, and then kind of some higher level stuff coming at the end. So here are a couple exercises that you can start out if maybe you're getting some of this similar pain, and kind of ways that you can go about dealing with it. So this is one little test and exercise you can do if you're feeling that pain in that lateral leg, to kind of see if your ankles are moving properly and check out some of your calf strength that you have going on. So the first thing that you'd want to do first is just kind of assess your ankle mobility with a simple calf raise. So we're just going to go straight up and straight down, and you want to make sure that you're going in a straight line up and down, and you're not kind of curving out to the side with your foot, because a lot of the times what we see is this kind of motion kind of going out with the feet, and we don't want to see that. We want to go straight up and down. So what you can kind of do is you can either take this with a straight leg or a bent leg. Straight leg is going to be a little bit easier to start out, so I would start with that, and then we could do a bent leg after that. So I want to see a single leg calf raise, just straight up and down, kind of tapping the heel to the ground. And you want to go straight up and down as much as possible, trying not to get this kind of compensation that gets the foot out like that. With a bent leg, it'll look very similar. It'll just be straight up and down. Okay, so for this second introductory exercise to dealing with that lateral lower leg pain or that foot instability, is going to be just your standard body weight squat. So here I have a band kind of like around my knees just for cueing purposes. You could do it with the band, you could do it without, either way works. What I want is, for this body weight squat, I want our feet about shoulder width apart, toes pointed forward. That's going to be really important for this movement. And as we go to squat down, what I want is keeping those toes pointed forward, but kind of turning that foot into the ground, keeping our foot planted right where it is. So what that does is kind of lets the knees drive outward against the band, coming up, kind of creates that nice arch on the inside of the foot. So again, what that looks like is we're just going to come down, twist those feet into the ground as much as possible, push those knees out against the band, and then coming back up, keeping all those toes down as much as you can. So our last introductory exercise for part 1 of the series is going to be your standing hip abduction. So again, I have a band right here wrapped around my knees, and a lot of the times what happens with this overpronation or this flat foot is a little bit of we call it a medial collapse, and what you can do for that actually starts all the way up here in the hips. So working those glutes, working those hip abductors is going to help pull everything up, in addition to the foot and ankle work that we're doing. So what you can do is one foot's going to kind of be up on the wall like this with this band wrapped around our knees, and we're just going to open straight out to the side and come back. You should feel this. You'll end up probably feeling it in 2 places. You'll feel it in the standing leg, in the leg that you're standing on, because you have a little bit of a hinge back here. Then you might feel a little bit on the working leg as well. If you get really good at this, then the progression will be keep that heel up off the floor on the standing leg. It's a little bit harder, but now you're getting your hip abductor activation as well as your foot and ankle stability.